Okay, it's noon. All right, a lot of people on today. Great. Thank you for coming. It's down there. Okay. All right. Well, as you may know, I am Dr. Narda Robinson, osteopathic physician, veterinarian, and founder and CEO of Curacore Med and Curacore Vet. So, for today's session, we're going to be talking about acupuncture for digestion and some of the mechanisms, some of the applications, a lot of the anatomy, so structure and function. So, just to review, what is digestion? I mean, a lot of us will think, okay, the alimentary tract, like this. But really, where does it begin? Because your your ongoing recognition of the source of problems in a bigger framework than just a point and shoot approach that you may have cultivated during veterinary school, or for those of you from the human world, from medical school, that we want to understand the problem deeply. And is it neurologic in origin? Is it psychological in origin? For digestion, where does all that start? Are we just only going to think of our typical default stomach and intestines? Hopefully not. So we say, okay, where does digestion start? Is it there in the chicken? Yeah. No. Is it here at the esophagus, the crop, or whatever species you're dealing with? Is it where the viscera begin? No. Is it maybe here where the artist's rendition shows that there's the beginning of where you swallow and your esophagus or whatever? No, not really, and not completely. So let us go further up. Is it there? So that's the head. Is it the brain? Is it the beak? What is it? So where does it begin? So let's just review. So up in the head, yeah, you're sort of right, sort of wrong. So really, I would say a lot of it begins with the food itself. Is it palatable? So, how is the animal going to know is it palatable? Well, you have to see it, you have to smell it, you might taste it. Is it poison? All those things let you know, is it safe to eat? Is it going to choke you? Is it going to poison you, which is a lot where taste comes in and smell potentially? And is it chewable, or is it even relevant for that species? But it still has to be consumable. So, as many of you know, that to review, digestion begins in the brain. So, whether we're going to see the food, smell the food, taste the food, maybe handle the food, whatever we're going to do, that has to be processed. And so even for some of you, I mean, it is noon, and I just brought this up, but even the thought of it, like you have this circadian rhythm now, perhaps in Colorado, it's noon, but so we say lunchtime. Okay, even for me to say lunchtime is probably provoking some neurologic synapses to occur. Like, oh, lunchtime, I should eat. Even if you just ate, you might be like, oh, okay, I can feel my digestive juices starting to seep out in my stomach. I should eat something. And then if I said, oh, pizza, mushroom pizza would be my favorite, but without the cheese and whatever, course, with a Diet Coke, but, all that stuff, and so we don't even have food around to see, smell, taste, handle, but all those memories of food and that conditioning that you have around it, that starts there too. So it reinforces the primacy of the brain. And, brain and nervous system, central, peripheral, autonomic nervous systems, all those together, quite primary. And, whether we even extend that to breathing, to your blood movement, your heart regulation. So as we go through this exercise, at the end, we're also going to bring in pericardium 6 or NAG1 because that also can influence digestion, but we can also compare and contrast the routes of stimulation, activation, neuromodulation between something that we think about in that regard, which is stomach 36 or Susan Lee, and compare that to another robust neuromodulator for the autonomics, which is NAG1 or pericardium 6. So, yeah, brain and heart have to work together. And then, even for reproduction, a lot of it starts in the brain. And so if there's a problem with reproduction, then we don't just go to the organs, but we have to think about what's the general environmental context, psychological context, all other kinds of things. Now, to be clear, digestion is not about chi. So why do I say that? Well, chi is what fills tires. Chi means air. So it's been, dare I say, bastardized over the past century because, as many of my medical acupuncture graduates know, Georges Soulier-Damarant in the 1930s was a French banker turned diplomat, was fascinated with Chinese culture, really wanted to show that acupuncture worked through the élan vital, the spiritual aspects. And so, as he says in his book, for lack of a better word, I chose the term energy to translate chi. Of course, he said that in French, but that's been what's been translated into English. So if you look up chi, and I have multiple English Chinese dictionaries, chi means air. Now, what the Chinese were referring to in terms of physiology, when you would inhale into the lungs, then those dissolved gases would circulate through the blood system. And really, because the channels weren't energy lines, they were just the vessels that carried the dissolved gases, within them in addition to the fluid, which was blood. So the Chinese weren't this whole, metaphysical situation in terms of acupuncture. They were actually very anatomically based. And it's just too bad that nowadays this whole chi thing is so alluring to the West because they're really recalcitrant when it comes to giving it up and understanding what's deeper and what the actual meanings are, especially, we're medical professionals. We should be approaching things scientifically. So anyway, you can go do your online shopping, go to pubmed.gov, where I like to shop, and put in the word chi. Okay, well, here's what you get. You get almost 50,000 things. And if chi was so all important and all encompassing and it's universal and everything and for thousands of years and this and that, wouldn't it show up in your top results in PubMed.gov? No, Doctor or Ms. or Mr. or whatever chi are what show up when you search for chi. It's obviously not what the earth spins around on its axis. Science is not waiting for chi to come and show that really that's what the workings are of how digestion or anything else happens. If I say chi digestion, the same thing. Researchers name chi come up. They do a lot of different things, but none of it's really about digestion. If we say TCM digestion, well, it gets us to trends in cardiovascular medicine. So you probably see where I'm driving at. And just for the record, for those of you from the TCM world that are joining us, if you haven't left already, the spleen, which you've attributed to the cause of diarrhea. So dampness in the spleen would make you poop watery. Yeah, not so much. The spleen, while helpful for immune function, does not digest food, no matter what your Chinese medicine master told you. So, where are we with all this? Just to give some sense of why that mistake might have happened originally and why we don't have to keep on clinging to it, is that probably the spleen was confused with the pancreas in ancient times, because when you dissect a dead body, the pancreas was really hard to dissect out and preserve. So, anyway, how are we going to understand digestion and how can we use that information to help us with acupuncture knowledge? And what does it come down to? So again, the Chinese medicine may talk about a yin yang balance, but we are in this day and age talking about autonomic nervous system balance. So the sympathetic nervous system, the parasympathetic nervous system, and how that all works. Now, again, back to how we are going to help our patients with mastication and digestion and all that. We have to think about, okay, can you smell the food? Can you swallow the food? Do you want to eat the food? This is Buster from my acupuncture from my marijuana wrap. Hello, I ate some cookies that I wasn't supposed to and got very sick. It was very bad. But so with our palpation, we are going to assess the animal. We're also going to talk about the environment in which the animal eats. So if there's problems with digestion that your patient comes in with, and if it is a nonverbal non-human, then we have to be really good diagnosticians and talk to the client. And if we are someday again doing a mobile visit, then we can see more what the surroundings are. So this cat does not look relaxed that much. I mean, the eyes aren't that dilated, and probably it's just a situation where the photographer put down the food and, snapped a picture in reality. But but this cat does not look interested in the food. And so we'd want to know what's going on. Is it environmental, psychological conditioning? Is it bad smelling food? Or is it further down? But we're talking about acupuncture for digestion. So we need to think about all of those because so often your acupuncture for inappetence is going to lead to these discussions. And if anybody says, what are the points to stimulate appetite? That makes me crazy because there's a zillion reasons for inappetence, especially in cats. But so is it dental? I mean, that's the first thing we're going to think of, or an early thing we're going to think of as well. What are the salivary gland issues? So if we are thinking about acupuncture, and if there was a condition such as xerostomia from radiation therapy to the head and neck, then we know that there are acupuncture points, your stomach points around here, as long as we're not going to interfere with the cancer or the treatment or the radiation therapy. There are things locally we can do. We will also want to use large intestine 4. Oftentimes what I would do is, when I would help the radiation therapy cases, they would call me in right after the radiation and before the animal had emerged from anesthesia, and I would do large intestine 4 to large intestine 11 and hook that up electrically and talking to the client about some neck massage. So it just matters how close you can get to where the cancer is in there. But remembering as we are going to be driving towards this, that digestion is about that autonomic balance, and we want to support the parasympathetic nervous system because it's usually the case for many of our conditions across the board that we treat that the sympathetics are over aroused and the parasympathetics are under aroused. That doesn't it's not like 100% true, but oftentimes it is. There was a puppy that I had adopted a couple of years ago who actually had overacting parasympathetics just because of the digestive disturbances that the dog had. And so, with massage and general ICU type care, he was able to come home and I adopted him. But he had low blood sugar, really low heart rate. They were thinking, is this a liver shunt or whatever? And it's like the dog just needed some massage and just regular attention in that way. If we talk about the salivary glands still, then don't forget your photomedicine and how strong, amazingly, the research is of photomedicine to the head and neck, to the face and the salivary gland areas for xerostomia after this head and neck cancer radiation. So it's kind of counterintuitive to use photomedicine for cancer patients, but if you look at the research, go shopping on PubMed.gov, you can find quite a bit. So moving from the salivary glands down, how are we going to get food into the body? And is there a problem with deglutition? Is there something laryngeal, pharyngeal, anything? Is there any stricture? Is there any pain? Is there any lack of sort of peristalsis in the esophagus? So just trying to pry open that tunnel vision that we get when we have digestive issues, and you're going to go right to stomach 36 and some back points. Don't do that if there. I mean, you have to just consider the whole animal, even if there's no problem swallowing and it's all further down the track. Let's say there's a lot of neck pain. That is going to drive up the autonomics. It's going to be very distracting. You just don't want to do anything. Your whole system is out of whack. So, therefore, you always have to palpate the entire structure. And then once you do get down the tube, then it's onward. But of course, we think about the biosphere, the enteric biota, and everything else in terms of nutrients and all that. But if we're going to influence digestion with acupuncture, we are going to work a lot in terms of neuromodulation. So we're obviously not going to just puncture an organ and call that good and hope that that works. So let's look at some of the approaches that could come up there because here, for example, large intestine 4, that is the biggest point on the large intestine line. And so you have on the thoracic limb, you have the large intestine line and the so large intestine line, small intestine line, and you'd think that that would be for intestines. Well, why isn't it? And that's because I don't know, it's just screwy the way these channels were named after organs, especially highlighting large intestine and small intestine, because for one, these are both coming, the large intestine and small intestine are coming into the cervical thoracic region through the brachial plexus. So those spinal cord segments are not involved with digestion in the gut. So that's way too far down. So what the Chinese I don't know, wherever it came along, they instead of counting on points on the large intestine line to work with digestion, they assigned like partner points on the pelvic limb. So stomach 37, 39, and the like, which just shows you that points such as this one, large intestine 4, weren't doing the trick. You're going to get maybe some general autonomic neuromodulation because of the double arterial arch system there and the rich amounts of vasa vasorum and a nervi vasorum in the hand there. So the nerves that are coming through the sympathetics that are supplying the walls of the arterioles and arteries there, they are going to be richly conveying sympathetic afferent information to the brain. Which is going to be neuromodulatory, but that's going to be overall. That's not going to be specific. Would we use points around the trunk? So around on the back or the abdomen here, because we know that from the sympathetic standpoint that we have points that innervate organs from the thoracolumbar, thorax, thoracolumbar, and lumbar and lumbosacral regions. So we could use that and come through spinal reflexes. And we'll talk a little bit about that. So that could work. There are also points on the front. So we think about the back shu and the front mu points. So those are there, and they're very tempting to use because they have their little pairs down the back and the front, and they have their associated organs that go with it. But lo and behold, research, which is important to rely on, whether you're dealing with a pandemic or some indigestion, then we need to see what does the science come out as. And it's not as strong for using the back shu front mu points as it is for the distal points, and we'll be talking about stomach 36 and even to an extent pericardium 6, which, it might be more fun to use the back points and the front points for an animal because stomach 36 is definitely not always well received, nor is pericardium 6. And that's harder when they're quadrupeds rather than a nice flat surface on the forearm. But here's a little exercise that you can do right now. I warn you, though, you may want to go poop afterwards. So I demonstrate this in class. A lot of you have seen me do this before. But this guy, he's got his hands on his hips and he's doing some kind of patrolling. But he might also be neuromodulating his large intestine if he might have had some constipation or something. Now, why would that work? So you see here, his hands are on the crests, his iliac crests right here. And so as an osteopathic physician, you learn that right there, level with that is you're getting to about L4 right there. And so bladder 25 is a little bit lower. But interestingly, if you do this right now and you press those thumbs into your back, you would likely start to feel like, oh, yeah, okay, I get how that might make you like feel like some movement has been happening. And so, note to self on for you guys that are veterinarians or vet techs or whatever, if you have a kitty cat, and this is not a kitty cat, but still, this is where I love treating cats with constipation or obstipation or any kind of GI thing, but dogs can get that too. You come down here on the paraspinal muscles, and I call this the lumbar gully because you come down here and there's this nice depression there. And a skinny cat, I don't really have many skinny cats, but you can see that little hollowed out area, and that's a great place for you to be massaging and potentially lasering if it's the right circumstances, and just checking that place out. So taking a closer look here and removing all the uniform and the skin and whatnot, so then you can see that it's not that far down. I mean, it's kind of in the frontish, but this is relating even mechanically as you're stimulating your mechanoreceptors and pressing in on those sites that that you are inducing some somatic afferent stimulation from this whole region here, and that's not necessarily going directly into the intestines, but it is going to be picked up. Remember your nerve pathways now. So your somatic afferent stimulation coming in to the nervous system and the spinal cord, and then neuromodulating those sections of spinal cord, so creating neurotransmitter changes and probably taking down sympathetic tone in the segments. Now, in the human, the spinal cord is going to end, but also the sympathetics end at sort of L2, L3. In the non-human, it goes further down. But anyway, the relevant spinal cord segments, you can get this somato visceral effect because you're starting with the somatic, the outer, nerve stimulation things, and then coming into the cord, and then there's going to be crosstalk. We're going to take a look at that. So, and this from my book, just let me see, figure 752 is still again looking at bladder 25 down here. Here, the soldier had the hands on at about here. So remember, this is the iliac crest right here. So we're getting to L4, which is here. Humans have 5 lumbar vertebrae ordinarily. And here you can see the ascending colon. Now that's because I took away all the muscles of the back and some other stuff, but you can see it's level there, and that you quite easily can envision some spinal cord neuromodulation going on. Here's a view, still from the book, from the right side, and this is the right kidney, but here you can see some of those splanchnic nerves, and this is your ascending colon again. And so if you have your hands on your hips right here, it's just, it's close. And the thing is that you should remember this because when you're treating, again, a cat with dysfunction, or especially rabbits that have ileus, or any animal with post-op ileus, what I like to do is gently and appropriately, and not in a puncturing way with any pressure, but making sure that I'm providing some really nice mechanoreceptor input, especially with a bunny or a cat with the hairball. I will kind of come right here onto the xiphoid process, just caudal to that, and in the epigastrium, and even just feel for that stomach wall and create some mechanoreceptor stimulation, like for bunnies. The presence of food would do, because we know that bunnies have to have food in their intestines or in their GI tract in order to stimulate that digestion. Well, my approach is to accomplish that, but externally, working with my hands and getting to initiate impulses in that way. So, in order to move from the miring of TCM and really understand that, let's take a nice look at stomach 36, which is going to be your go-to point for so many things. And here, if you haven't found it on yourself, on the side here, this is where, let me see. So your pinky would be to the lateral aspect, that you could use your right hand. Put your middle finger right on your tibial tuberosity, and so where your left tip of your ring so where the tip of your ring finger hits whatever's, yeah, it would work on both sides because you're bilaterally symmetrical, like mirror image. So either leg, tip of third finger on tibial tuberosity, and then just in a relaxed fashion, your hand should be placed over the kneecap, and the tip of the ring finger is about where stomach 36 is. That's just that way to do it. And then we're going to compare that to pericardium 6, which, if you remember, is 2 finger widths proximal to the transverse crease, to the distal transverse crease of your carpus or wrist, and then just fall into a hole right there. So that's pericardium 6. And as you know, if you took my math course, that is over the median nerve. All right. So pericardium 6 just in the awake specimen, and stomach 36 down here. Okay. But we want to look definitely for more than just muscles, and we're going to look at all these different layers. The vessels we're interested in, especially the nervous system, and the lymphatics as well, but because it all comes into play. So if we think about stomach 36 and look at the way that the channel has been drawn historically, and this is what your Chinese medicine counterparts are looking at, that for stomach line, here they so as you know, it begins right under the eye, so stomach 1, and then we're coming with a loop and going up to stomach 8. Now they have little doodaddy dashed lines here that attach the channel inwardly or to other channels. But essentially, there's a short loop with stomach line, and then it rejoins here. So stomach 8 up here, and then 9, 10. Remember, just for review, that 9 and 10 are going to be closely associated with the carotid body, especially stomach 10 is. Stomach 9 is what we would use to maybe surround the thyroid if we were under the probably misimpression that it's going to assist with thyroid problems. But I will use stomach 9 for laryngeal issues. So if we continue to keep our focus expanded and think about, is there anything facially that is problematic for digestion, then that's where we can palpate on the face. Of course, we're not going to just palpate acupuncture lines. We're going to palpate all the stuff. So we're going to palpate the mandible, the TMJ, the masseter, and look for problems. We're going to think about dental issues as well. Is there a sinus problem? Is there a problem with that cat that we saw, like smelling the food? So many things to think about because we don't want to spend our time using stomach 36 and aggravating the cat if the cat has a stuffy nose. We would do a lot of different things, and I would do some just cranial manipulation on the glabella and help those nasal passages open. So that's where your digestion treatment or your inappetence treatment turns into a upper respiratory situation. Always, 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 we want to have a good diagnosis. But anyway, as this stomach line resumes, it's going to zoom over the clavicle in the human and down. Now here, the stomach line is going over the abdomen. Okay, so that's where we can think about our ventral spinal branches and how we might neuromodulate intestinal stuff. But really, it's when we come down to stomach 36, so 35, 36, down here below the knee, that curiously, that's where the big point is. You have all these other points. Do you remember how many points there are on the stomach line, right? All the way down to the toes here. So there are 45 in case you forgot. But the points that the Chinese medicine kind of approaches have used instead of the large intestine ones on the arm or the small intestine ones, they have relocated them down to this cranial tibialis or in human anterior tibial muscle because this is where the cool afferents are. And who knew? I mean, just I don't know, but it's when researchers started to try to plot out the brain changes that would happen when you're needling down here. It's like, why are you saying, balancing yin and yang and stomach chi and all this stuff? It's just essentially you're having some regulatory effects on the abdominal, workings. And how can we trace that out? And so that's where we're going to go up. Remember to our friend, the nucleus tractus solitarius in the brainstem, and identify those sites. But what one would learn in Chinese medicine is instead of the nervous system, is that there are these divergent branches that are going into the stomach and whatnot, and that's why it's called stomach line. Of course, nobody knows. And it's just like retrofit sort of BS if I want to really alienate anybody that's still here from TCM world. But anyway, it's this imaginary line and connection that, oh, it must be going right through the stomach, like somehow through the body. Yeah, it's not. Because originally these were following myofascial cleavage planes or vessels or whatever. So don't believe that. Okay, so again, from the book, that this is stomach 35 here, lateral to the patellar ligament, and then we have stomach 36 here in the anterior tibial muscle. And we showed you how to find that before. Now, I love the cross sections. I didn't at first, but after my second or third rewrite, I began to really see it. And in our rehab course, in the MOVE course, we have a section on fascia and just just really appreciating the enveloping and the connecting and the force distributing nature of fascia. And so that's a lot of what I just love seeing here. But for stomach 36, we are also looking at, okay, if we put a needle through that, number one, how deep are we going to go? What are we going to stimulate? We could get bitten if it's any kind of veterinary thing. Humans will put up with it, but they might say, ow. But anyway, it's so rich with afferents. It's rich with groups 1 through 4 afferents, and if you think of that, like, in terms of the sub-Q, afferents, we have our A beta, just all those different down to the C fibers. You got your A deltas, which are for sharp, your C, which are for more burning, prolonged. But it's your thick, well myelinated fibers, like the A beta ones, that are carrying that mechanoreceptor information. So similarly, in the muscles, you have different types of names here, but they're still going from your well myelinated to your unmyelinated, and that's important. So having identified that stomach 36 is rich with all these afferents, you're going to get a big somatic afferent, information download to the nervous system from there, or upload as you may uh, prefer. So, what are the typical indications that we're drawing from the human knowledge and transferring to the veterinary? So, gastric pain, vomiting, abdominal distension, diarrhea, and constipation. So, you see, I mean, it is curious why one point would treat both diarrhea and stimulation, and it's the neuromodulation that gives you that answer to the question. But it's also good for insomnia and depression and knee pain and leg weakness and paralysis. So, how can all that be? It just must be a special point that God put on this earth for our use. Well, who knows about that? But if we look at all the tissues that are there, then we can understand, again, that structure function relationship that then gives us insight into the implications for the indications. So, Chinese medicine, it was called leg 3 miles. Lots of folklore about that. Is it that when you would get acupuncture there, if you were really tired, that you could still go 3 more miles on your journey? Or does it have something to do with the measurement and the 3 sun and all that stuff? But this is what the Chinese medicine, for comparison, says is what stomach 36 is doing for digestion, tonifying qi and blood, harmonizing and strengthening the spleen, right? And the stomach, the yin and yang, and strengthening the body, raising the wei qi, raising yang. I mean, all this stuff. Okay, if that's what you like, fine. Hopefully, you are thirsting for more. Okay, so stomach 36, the science. Remember, Helene Langevin gave us this information along with her engineering colleagues at University of Vermont Medical School, is showing how, as we're inserting the acupuncture needle, that there are collagen fibers that are attracted to that shaft, and in so doing, the fibroblasts that are kind of connecting to those collagen fibers, they deform, so they flatten out, and with that stretch and the deformation of the fibroblasts, that is changing the metabolic state of those important cells that are going to do so much with healing the local region, just putting out all kinds of growth factors and stuff, but also that there are nerve fibers embedded in there that are going to get stimulated and pulled a little bit. And if we needle appropriately, then we can know that we are stimulating mechanoreceptors and not nociceptors. So we really don't want to have animals all tied down like sometimes I see, or just forcefully kept in one place. We want animals to be relaxed because they need to be relaxed when they're eating. They need to be relaxed when they're getting treatments. They should be relaxed when they're at the vet. So fear, anxiety, stress at a low, low level. And that will help your fearing, anxiety, and stress as well. So, just to review, that what is neuromodulation? Well, we're putting in a signal through our acupuncture needling that is coming in ideally through the mechanoreceptors that are going to be pain dampening. And we're going to be engaging with the steady state that already was there. And then we're going to create a change in whatever reverberating signals there are within the body. And that's why it's important to have an understanding of where that individual is starting from, because like some of the, I think, rat experiments physiologically, I mean, if you're already normal, then you're not going to see that much with neuromodulation. But of course, with rats, I mean, they're turning up the electricity like super high and it's becoming noxious. And so you're going to get changes then. But like with the imagination that you have yin yang balance induced by stomach 36 stimulation, that whether you have constipation or diarrhea, you're coming back to normal. Well, that's because you're neuromodulating, and we know where that's happening because we're shifting autonomic tone, we're shifting neurotransmitter levels, and we're just working throughout the system and considering the spinal cord and brain. So with acupuncture analgesia, which stomach 36 is good for too, just generally because it's vagal stimulating, it's parasympathomimetic, it's pro endorphin, and other transmitters that are good for you. So as opposed to nociceptive stimulation that is coming in through here, getting at your A delta and C fibers like we just talked about, and then stimulating the dorsal horn in a painful way, and in the human going up the spinothalamic tract with touch. So light touch, vibration, massage, your gentle needling and activation like that, that you are preferentially activating mechanoreceptors, which are your A beta neurons, your thick, well myelinated fibers. And so we're going to be reviewing the gate control theory just a little bit because that was an early idea, and there were still aspects of that hold, but we know how much greater and more expansive these analgesic activities are, especially when we're getting up to the midbrain and medulla and thalamus and even brain networking. So if we review that, okay, and then we're at the dorsal horn, and just again looking at this with the thick, well myelinated aspect and thinking about massage or light touch or very pleasant acupuncture, that is going to be facilitatory or promoting that interneuron that is going to be inhibitory to migration of that pain stimulus to ultimately the thalamus versus your unmyelinated or poorly myelinated fibers are going to be inhibitory to the inhibitory interneuron, and then that means allow more pain to or nociceptive stimuli to reach the brain. So that's just one piece, but it's still part of it. And then we can add our e-stim and all that. So here's stomach sort of 36 working as an example with your electroacupuncture analgesia, which is going to heighten that input into the body. And hopefully we have it at a nice level and not a noxious level, because then we're going to not drive the parasympathetics and balance out those hyperactive sympathetics. We're going to make the hyperactive sympathetics worse. But thinking of what stomach 36 does, even if we were treating knee pain, and this is such a rudimentary treatment, it's so just kind of recipe based. I would do it differently, but anyway, this is not my photo, it's a stock photo. Thank you, Shutterstock. But anyway, whether you were treating an individual for knee pain or not, you're still going to be getting all these other effects. It's not that the acupuncture needle says, "So, doc, which of these things that I do you want me to do?" It's all going to happen. And so, I remember, people during our medical acupuncture course talking about, well, why does the dog poop after I treat them? Well, okay, you got to think of everything that you were doing and how there might have been poop already there in the intestines, and you're just helping that come out. So realize that and plan for it. So we have to really think of all the different tissues that we are affecting, and that's why we're medical acupuncture. Anyway, so the stimulus goes from local peripheral activities to in the fibular nerve to the sciatic nerve and up. So that stimulation is coming into the spinal cord from these nerve branches, and we might get some somatovisceral reflexes. So in the small carnivore, we have that sciatic nerve and hence the fibular nerve, that there's L67S1 there. And so it's going to be in those segments of the spinal cord. In the human, it's going to be more your L4, 5-ish region. But anyway, those same segments of spinal cord are what will also send some sympathetics into the intestines. So we thought of the soldier with his hands on his hips and the mechanoreceptor aspects of pressing in those regions, and the large intestine organ parts that were on either side there. But then this is that neurologic piece where as we stimulate mechanoreceptors, not only so there's the pressure, the mechanical pressure, but there's also those neurologic signals that are coming in and making that loop from somatic to visceral. And then we're going to go back up to the brain because you're not using up all the nerve impulses yet. Some of them are going to be left over and go up to your head. So just to recount that here's a viscerosomatic reflex, the viscera, the autonomics coming into the cord. So these are your sympathetics. Well, you're going to get some vagal too, but that's going to go up. So 1, 2 into the cord, and then 3. So we can have a viscerosomatic reflex, which is where if you have gallbladder organ problems, that you could have shoulder pain. It's where you have a problematic appendix and you get McBurney's point on your abdomen. It's where you have chest pain, you have a heart problem and it's coming out your arm or into your face or whatever. So there are cross-talking neurons, again, with interneurons in the spinal cord, where you have nociceptive input from the viscus that makes its way to the spinal cord and then will show up in different ways. And we have to be cognizant of that so that we can address it and understand it appropriately. So then with acupuncture, we might come in through the back looking at just going the other way. And we can hope with the back shu and front move points to make a difference and neuromodulate the cord enough that we're going to calm down that segment of cord and reduce sympathetic overdrive, which is what happens with a wind up situation. But again, I mean, that's something I would add in there, but it would be especially helpful if there was actual back pain. And then you're helping to calm down that cord and calm down the sympathetics. And that's maybe what has really contributed to an awry kind of digestive system. But it's going to be your whole approach. It's going to be your palpation, your identification of finding where there are pain problems and, maybe social, environmental problems, also putting it all together, doing some massage on the body to help relieve that burden of pain that is driving up sympathetic function, but also work in a way that is parasympathomimetic and not just having to rely on stomach 36, but your nice moderate pressure massage, your general approach, and your treatment of pain also. So these are your bladder points, your paraspinal bladder points. So we've been thinking about that. But what we want to move then to is the nucleus tractus solitarius, which is here in the brainstem. So in the medulla. And that sits side by side with the vagus nerve, especially that dorsal motor nucleus of the vagus, and there's crosstalk there. And so if we are wanting to reduce sympathetic overdrive to help that gut stimulate peristalsis, so this is your parasympathetic connection, want to stimulate peristalsis, stimulate, all the things that help your digestive system from saliva and on that uses your vegetative aspects, then we want to see, okay, how do we access that? So the vagus nerve is a big draw for that. So we can cut down the sympathetics with whatever trunkal treatment we're doing, but then we can work with long loop brainstem reflexes, which is going to be what connects stomach 36 all the way up to your nucleus tractus solitarius, as well as the rostroventral medulla, which we will talk about with pericardium 6. Those are somatoautonomic convergence sites, you will remember. So just like if this is the nucleus tractus solitarius, then she is receiving all the time, especially, during waking hours, but probably during sleep too, somatic input. So what's happening out in the periphery of the body and what's going on inside? What are those visceral afferents talking about in terms of the presence of food or just whatever, over distension or hunger or whatever. And so this nucleus tractus solitarius has to make sense of what's going on in both realms, and who knows, maybe some more too. So when we come in with acupuncture, we're doing an intentional somatic afferent disturbance that nucleus tractus solitarius is like, oh yeah, that's right. I was getting, whatever input, or I am upset with this or that or the other thing, but you are speaking to me now directly and reminding me that this guy that likes his spaghetti quite a bit is having issues, and so I might want to change my signal, my direction to the dorsal motor nucleus of the vagus, so that it will change like secretions and peristalsis and the orchestration of motility and all that stuff. So, so it is the nucleus tractus alteris that maintains homeostasis in so many different areas, and it's this teeny tiny segment of nerve tissue. But the fact that we can speak to her with our treatments, not just acupuncture, but so many different things, is very cool. And is the surgeon going to do that? Not in a nice way. Are drugs going to do that? No, sorry, not really. But that's why this is our time, especially with things as they are. We don't need to, order all kinds of drugs. It's nice to have them, but there's so much that we can do, even in what's going on now, or again, on that desert island you might find yourself on, or wherever you are. This is just natural, effective way to treat without having to rely on other things, or that can work adjunctively with other things. You got to just make sure you're treating the problem. And so the first thing is your diagnosis, of course. So then we've gotten um, over our gastric pain, vomiting, abdominal distension, and diarrhea and constipation, though we might want to have PC6 there for the vomiting piece to help us out. And then we have these other things as well, the insomnia and depression, that's going to be vagus nerve stimulation, our local knee pain. We're going to do a good palpation exam that is going to not just focus on the front like that treatment was doing, but we're going to go all the way around to the back, and we're going to go to the popliteus, and we're going to go to the attachments of the hamstrings. We're going to go to the gastroc. We're going to go to the hip, everything to really treat that knee pain. And we're not going to order a TPLO. And then leg weakness or paralysis, because we're working with those nerves. So how does it work for a GI system? We've talked about the long loop reflexes and potentially some spinal reflexes through that lumbosacral cord. And just to remember also from a physiologic perspective that as we are inducing parasympathomimetic effects, that is stimulating the cholinergic system, which is going to be anti-inflammatory. That is going to offset a hyperactive sympathetic system, which is pro-inflammatory, as outlined here. And I'm sorry that I don't have the reference for where this is. You just see it randomly on the internet, but I would like it to have given credit to wherever this came from. But it's a nice depiction of how the brain is connected to the gut, and how if you have things going awry and that nucleus tractus solitarius isn't listening, isn't picking up the phone, then things get out of whack and the sympathetics predominate. We don't like that. So what does the medical literature say? Remember, we searched for qi, didn't find much. We searched for qi TCM, qi digestion, not much. Well, here, go shopping, pubmed.gov, even not writing nucleus tractus solitarius out, but just abbreviating it with stomach 36. Oh, okay. Modulation of neurally mediated vasodepression and bradycardia by electroacupuncture through opioids in the nucleus tractus solitarius. Look, nucleus tractus solitarius even has her own opioids. Anti-inflammatory effects of acupuncture stimulation via the vagus nerve, electroacupuncture for hypertensive rats, stomach 36, gastric-related neurons in the spinal dorsal horn, which we've talked about, and the nucleus tractus solitarius, appetite regulation, food intake. So this is where you don't have to just rely on my, masters and their masters' knowledge, but you can actually go to pubmed.gov yourself and check my work. Studies of the central neural pathways to the stomach and stomach 36, it's just all there. Why would we want to imagine that we're treating the spleen and that the spleen it has too much dampness and we're going to expel the dampness if we can learn all this stuff? It is just inherently more satisfying to see it scientifically. So now if we go to Naguan, pericardium 6, and again, we see the pericardium line, but we also see this imaginary kind of T-shaped route to the heart, which is complete and utter nonsense. No, it was good for 250 CE. That's fine in the Han Dynasty. Okay, it was good, but where are we now? 2020 CE. We can do better. So again, from my book, but looking at this whole PC4, 5, and 6 along the median nerve, even PC7, and then we're branching into the hand, that we can see it's all related to the median nerve. What does the median nerve do? It goes to both the nucleus tractus solitarius, and the rostroventrolateral medulla. It is important for digestion that involves nausea and vomiting, but also is good for angina and arrhythmias, cardiac palpitations, and this and that. Of course, you want to have appropriate medical attention if you're having chest pain, but this is a good one for antiarrhythmic and anti-anginal effects to consider. So, blah, Chinese medicine. Pericardium 6, whoa, look at that needle. You could go through and through. I've seen some Chinese needling done, and you go through this way and you poke it through, tent up the triple heater 5. That's not what we recommend, though. It's done, but we don't recommend it. So, tissues affected, what all is there? So, just like the knee, it's all kinds of things there, including muscles, and it could be stuff that's giving you carpal tunnel syndrome there or in your elbow. That's another story altogether. So, we're finding that we're looking at the cross sections and appreciating the different levels of things, seeing the median nerve rather superficially here. And but it's like, okay, it's all okay, it's a bunch of structures, but what's really great about it is it goes to the brainstem and it's going to your two centers, your rostral ventrolateral medulla, as well as your nucleus tractus solitarius. What does the literature say for heart disease? So we're still dealing with similar concepts. We're looking at another comparison point, but both of them have somato-autonomic convergence influences. And this is pericardium 6 attached to pericardium 4. And that makes sense because they're both associated with the median nerve and receiving electrical stimulation or not. But it's showing that you can get cardioprotective effects of transcutaneous electrical acupuncture point stimulation in perioperative elderly patients with coronary heart disease, prospective randomized controlled trial. So that's your online shopping, but it's also helping with postoperative nausea and vomiting in children. And acupuncture reduces the incidence of postoperative nausea and vomiting, as well as the utilization of antiemetic remedies, particularly during the first 4 hours following the operation. So you're helping with that, that malaise, emetic kind of thing, but you're also going to be helping with peristalsis. So postoperative ileus is another thing. So there's just, this needs to be frontline consideration, needs to be right up there. Why are we going to wait until drugs fail and cause their own problems till we start to use it? So the key points for all this, we love the structure, we love the physiology. This is how we're going to understand how medicine works, going back to basics, and doing research on the anatomy of points and the physiologic stimulation effects is it's sometimes going to validate traditional indications, but we certainly don't want to just sit there. We want to go further and understand for which conditions, for why. And I mean, the traditional indications are a nice guidepost because that's what is directing a lot of the researchers, and their interest into, oh, let's see how this actually works. But you keep moving forward. You don't say, oh, but I really love being a shamanic princess and priestess. And I love people thinking that I have spiritual powers. Yeah, okay, there are courses for you in that. But anyway, so we can base our needling protocols on scientific research and neuromodulatory goals, and that strengthens evidence based clinical medicine and really justifies our including acupuncture as first line care. So, I know many of you are graduates of our medical acupuncture course. If you're not, this is, yeah, you can find on curacore.org/vet information about that. We've separated the course into small and large animal for the most part, except our makeup course later in this year. Because of the April COVID situation, we have refresher courses, Catchupuncture for the finicky MAV grad, exotics, no woo-woo, just science, and everybody loves that, and advanced medical acupuncture, which is purely online. So appreciate you being here and signing up and joining me. I do not see any. Oh, wait, there are questions. Can you use acupuncture prior to the patient awakening? Yes, good question. You can, and that's what I would do when I was treating that, just the salivary gland problems, the xerostomia in the little dogs that have received acupuncture to the head and neck for like a nasal adenocarcinoma or something. So I don't want them to be completely anesthetized, but when they are just emerging from anesthesia and they're still, then I can get a lot of good stimulation and use my electroacupuncture. And does that help with nausea? Yes, yes, we can do a lot for nausea. Actually, postoperative nausea and vomiting, as well as to some extent chemotherapy-induced nausea, are some of the strongest supported acupuncture indications, and those both go back to PC6, which is why I wanted to include that. So thank you for your questions. If you have any additional questions, feel free to email me, narda@curacore.org. If you just have general administrative questions, is info@curacore.org, or just visit our website for recordings of our past webinars and what's coming up. So thanks for being here. Take care.